Hello and welcome to the East Ward Update. I'm Derwin Montgomery, Council Member of the East Ward. On this show, we'll be talking with community and business development staff about a new program, TURN, a program that focuses on housing and neighborhoods. But first, February has an important deadline with regards to applying for affordable care. My first guests are Lafayette and Sandra Miller-Jones. It is great to have you all here to talk a little bit about the Affordable Care Act and talk about what's really getting ready to happen here now. So first, you take just a couple minutes to introduce yourself, and then we'll jump right into what's happening with affordable care.
All right, my name is Sandy Miller-Jones, and I am President and CEO of Segmented Marketing Services. We're a company that has been working with companies, other folks, for the last 2 years, helping to educate people about the Affordable Care Act, giving them an opportunity to enroll and giving them the information that they need so that they can get a subsidy.
Good morning. I'm Lafayette Jones, and I'm publisher of Urban Call Publications and also CEO of SMSI Urban Call Marketing. And with our sister company that Sandy described earlier, we are about the business of helping our community enroll for affordable health care. We work for Fortune 50 brands across the country, and for the last 35 years, we've been in business. So we're applying those principles and key learnings to this business of getting our community signed up.
So tell me, when is the deadline? When is the deadline for signing up for affordable care?
February 15, that's the last day that you can sign up for insurance, health insurance at all in most instances.
So February 15th is the hard deadline, and this is for individuals who have already in the past signed up and for people who are newly signing up?
Absolutely.
So tell us about that process.
Well, on February 15th, those folks who want to have coverage by the 1st of March can sign up. If they signed up last year for 2014 and they were eligible for what is called a tax credit or a subsidy, then they can reapply again. They don't have to reapply, but they can roll over. But it's best if they do reapply because you'll get the best economic benefits that way.
And so where do they go to sign up?
We have certified and qualified people stationed at 3 Goodwill locations, one on Wartown, one on Peters Creek Parkway, and one on University. And we have people there just about all the time, but definitely on Thursday, Friday, Saturday, and Sunday from 10 to 6.
And so do they need to call ahead, or can they just drop in on these locations?
All of the above. They can drop in locations. They can call our 800 number toll-free, 866-341-5283. They can email us, and they can also text us, and we'll share those numbers with you later. But they also can go to Beauty World in North Point Shopping Center, not the North Point Shopping Center, North Side Shopping Center. And there are about 10 or 11,000 people that visit that facility every month. And so we have folks there. These folks who are signing up are certified licensed insurance agents, and they're also certified by the Center for Medicaid and Medicare centers. So they're ready to go. So you can go to a site, you can call on the telephone, you can text, you can email, and we're glad to help. We have about 40 people who are engaged in this activity.
And so as of now, how many people with the organization that you all have engaging? Do you have a number of sorts that you all feel you've interacted with and begin to sign up here in our community?
Well, let's talk about what we did last year because it's so early this year.
Okay.
So many people sign up just in the last few weeks. Last year we were able to sign up over 3,500 people, and we reached over 500,000 with messages just to motivate. So that represents about 1% of the total people that were signed up last year for affordable care in North Carolina.
And were there any people who maybe stood out in that process in terms of when you all are working with them or the rest of the staff that kind of jumped out in terms of their story of their health care costs and what they were able to say? Were there any individuals like that you all saw?
Sandy?
Yeah, we've got a young man who is working with us now as a certified agent, and he came on board because his mom was not able to get health care when she needed it, and so unfortunately she passed. And so he came and to us and got health care for himself and his family, affordable health insurance, and then decided that he wanted to help other people do the same. So he's now on board with us as a certified agent, and he's out helping people get health insurance as well.
And I think that makes a grand difference in communicating that message when
Yes.
it can be made very personal for people to understand, one, why it's important, and then one, understanding what opportunities exist out there for you.
You really have put your hand on the issue. It's all about trust, it's all about knowledge, and it's all about having people who can help you do this. We now are on radio, television, we're doing interviews with shows like yours, and we also have direct mail, social media, newspapers, and other kinds of public relations. And the whole idea is that we make our community aware. The federal government has done, in our opinion, a really good job of making this health care available to us. That is a tax subsidy. All we have to do is do it on time and sign up and go and get some help. Let me just say one other thing. One of the things that happens often is our people wait to the last minute, and that's a problem. There are not enough of us, if you will, to sign up so many people. And there are also some folks who don't have access to computers because you can sign up online. And so we urge people, do it now.
So if I'm coming into one of these sites, is there anything I need to bring with me?
You need to know, even if you don't bring, you need to know what your estimated income is going to be for this year. And you need to know your Social Security number as well as your employer's telephone number. Those are the key three things that you really need to know in order to see whether or not you qualify for a subsidy. Now, anybody can sign up through the Affordable Care Act, whether they qualify for a subsidy or not. A subsidy is the government helping you to pay for your medical costs, your premiums, as well as your other medical costs that you might incur. So 87% of the people who do sign up do, in fact, qualify for a subsidy of some sort. Some people qualify for a subsidy large enough that they don't have to pay any premium at all. So that's an important factor.
And it could be no premium at all or very low premiums. And so the first key is find out if you're eligible. Also, you should know your income. It's amazing the number of people who don't know exactly how much money they make. That's very helpful.
So tell me, what are the messages that you want to, if you had to leave a message with people, what is that message?
Probably several. Go ahead, Sam.
Sign up now. Make a telephone call, and don't put it off till tomorrow. Go ahead today and make that call.
And don't pay the penalty. The penalty is a tax penalty. If you don't have health care in 2014, 2015, when you file your taxes, there is a penalty. And that's a needless expense when you can have the health care insurance. And also the other thing about health care insurance, good health care is like good financial stability. And that's one of the keys to moving ahead in our lives.
So tell me just a little bit more on that penalty before we change up here. What is that penalty?
Sandy?
For this year, if you did not sign up last year, it's $94, $95, or 1% of your income. If you do not sign up this year, when you file your taxes next year, it's going to be a little over $300. And that's for an individual. For a family, it's even more expensive, about $200 per person per family.
So there's incentive also there to make sure people continue to sign up as well.
Yes.
So I'd like to say thank you for being here. Thank you for the work that you all do, because I think that it is very important for our community to understand and know, as you said, Lafayette, that good health care is like good financial stability. I like that because I believe it's true.
It is true.
I believe that's very true. So again, thank you so much for being here with us.
And thank you for the job that you're doing.
Yes, we
Thank you.
appreciate it.
Thank you. When we come back, we'll talk about a new program in community and business development. We'll be right back.
Even though we face the difficulties of today and tomorrow, I still have a dream.
I have a dream that one day this nation will rise up
and live out the true meaning of its creed.
We hold these truths to be self-evident, that all men are created equal.
And this will be the day when all of God's children will be able to sing with new meaning.
My country, 'tis of thee, sweet land of liberty.
Of thee I sing.
Land where my fathers died.
Land of the pilgrim's pride.
From every mountainside,
let freedom ring.
And when we let it ring from every village and every hamlet,
from every state and every city,
we will be able to speed up that day
when all of God's children,
Black men and white men,
Jews and Gentiles,
Protestants and Catholics,
will be able to join hands and sing in the words of the old Negro spiritual,
free at last.
Free at last.
Thank God Almighty, we are free at last.
Welcome back. Turn, or Transforming Urban Residential Neighborhoods, is a new program organized by Community and Business Development. And joining me today to talk about it is Richard Brooks and Sharon Johnson. Mr. Brooks and Ms. Johnson, will you tell us a little bit about what you do in Community and Business Development?
Sure. I am the director of the department, and Community and Business Development is a department that is responsible for administering several different programs that address quality of life in our neighborhoods throughout the city. We have a business development division that's responsible for administering several programs that are designed to assist small businesses in their creation and in helping them to grow their business. We also have a housing development division, and Ms. Johnson will talk about that. We have a planning division, and they are a liaison between the department and our major funder, which is the Department of Housing and Urban Development. And we also have a code enforcement division, and that division is responsible for enforcing various codes in the city, such as the minimum housing code that deals with graffiti and housing and grass and trash and cars and those things that would otherwise make a neighborhood unattractive. So that's principally the major divisions in the department.
Ms. Johnson.
Thank you. I am the Senior Project Supervisor for the Development Division. As Mr. Brooks said, we're responsible for providing low interest, no interest, and deferred loans for the citizens of Winston-Salem to rehab their properties. We're also responsible for the Youth Build program. We're responsible for the lead grant program that was funded through HUD, and now we're going to be responsible for TURN, so we're excited to be here.
So what is this TURN program? What is this all about, and how did we get to this place?
TURN was birthed, if you will, from a sister program, RUCA, which is revitalizing urban commercial areas, and in 2002, City Council realized that you had a number of declining commercial areas, and there was a need to address this decline because it was having a negative impact on our neighborhoods and our communities. As a result of the success of the RUCA program, TURN was created to address those residential sectors of these communities that are also in somewhat of a declining state in various neighborhoods, and TURN will help to turn those neighborhoods around by providing financial assistance to both investor owners and residential owner occupants to repair their property and to address some of the infrastructure needs in the neighborhoods. Sharon?
Through code enforcement, we have looked at those areas that have the highest number of code violations. And so from that data, we were able to ascertain 24 target areas that we have enlisted into the TURN program, and they are throughout the wards. And so, as I said before, they are based on the highest code violations that we have. Also, we're going to be providing interest loans, low interest loans for owner-occupied, as Mr. Brooks said, and investor owners. The interest rates will be anywhere from 0 to 4%. They will be amortized over 20 years. We also have the caveat of some forgiveness over a 5-year period of time. So we've tried to look at some financing that is going to be proactive to get people who are interested in the program to rehab their properties. And as I indicated before, TURN is another initiative, but we still have our regular rehab program for folks who are not in these 24 identified areas.
And so, where did this money come from for the TURN program?
Well, we're happy to say that $4 million was approved in the bond for the TURN program, so we're excited. The council heard the concerns of the citizens, and the citizens responded when we put that request out there for bond money. So $4 million was approved in the bond.
I know you mentioned that there were 24 areas within the community across the city that were identified based upon code violations that would quote-unquote qualify for this TURN program. Now, what is the process if my neighborhood is on that list? Then how do I know whether or not my neighborhood is going to be chosen? What is that process of actually selecting those areas within the community?
I'll let Sharon talk about the process, but before, I'd like to say there's also an opportunity in this program to get neighborhood residents actively involved in the program, because we realize that we can't go into neighborhoods and expect success without having residents in those neighborhoods engaged in the process. So as a part of TURN, community development corporations or neighborhood groups have an opportunity to form what we're calling coordinating agencies. And those coordinating agencies will help market the program in their particular neighborhood. As a result of them marketing the program and helping to bring residents to us for application processing, they will receive a percentage of every loan that is processed in order to transform or transition that money back into the neighborhood for some good neighborhood purpose. And Sharon may want to comment on that.
Well, when you ask about the process, once we identify, we have a roster now of neighborhood associations that have been affiliated. This agency that's going to be working with us is going to identify other folks or groups within those neighborhoods, and then we will establish almost like a mini training program to bring those agencies in to make sure that they are fully aware of what the guidelines are, to be able to help sponsor and bring people to the table to know what the program is about. So we will have training for them. We will provide that information. We will then probably go back and hold additional neighborhood meetings to get the word out about the program. And then once people apply, they will have a standard application. We will assess them. We have staff who will work with them to determine whether or not they meet the program guidelines. And then we will move forward with assessing their properties, doing appraisals if necessary, in order to complete that process.
And you mentioned something about program guidelines. Within that, in terms of an individual who owns a piece of property or is renting a property in there, as the owner of that property, and they hear about this TURN program, what are the qualifications for them? Is it simply being in the neighborhood? Is that all that you have to do to qualify to apply?
The first thing is being within one of those targeted neighborhoods. There is an income requirement for those who are owner-occupied. They must be 80% or below area median income, which is established by HUD every July. If they are investor owners, then they must agree to rent to low to moderate families who also meet that 80% AMI qualification. So you must be in the targeted designated area. You must be at or below 80% of area median income, and that is for the total household income. And when we assess your property, the work cannot exceed $45,000. So the maximum that we are willing to invest into a property is $45,000. When we looked at our average rehabs over the last probably 6 to 7 years have averaged about $25,000. So depending upon the cost of your work to be done, we're looking at being able to complete anywhere from 17 to 34 houses in each of the designated areas, depending upon how much your work costs.
And right now, what is 80% of area median income?
I believe it's about $45,600 for a family of 4.
And so as we look at that and that qualifying metric that we have for community, for a neighborhood, and individuals being able to access those dollars to make repairs, improvements to their property, and the neighborhood overall benefiting from those things. When we look at the concept of TURN and that word, transforming urban residential neighborhoods, we know that just working on the physical structures in the neighborhood doesn't always change mindsets and those kind of things. And so part of this process is that organization, that neighborhood has to be tied to some type of neighborhood association, some type of larger body that's working within the neighborhood. Is that not correct?
Yes, that is correct.
And what are some of the things that we hope for in terms of that collaboration between that organization and that neighborhood or neighborhood association?
Well, I think part of it is, that grassroots movement. Certainly one person can make a difference, but when you get a group of people coming together in their community, I think that's where we will see the change, and they're going to be the funnel, for lack of a better word, to bring them to the city to help us be able to disseminate all of the tools that we have available. As I said before, TURN is not the only tool that we have available, but I think that is what is going to make the difference, that you will have a group who is targeting a specific neighborhood, unlike our other regular rehab program where we may do one house on this block, one house on the other block. Can you imagine 17 to 34 houses within a community that are going to be rehabilitated? So I think that grassroots effort and involvement and people taking ownership is what's going to make the difference.
And I think that large impact is, I think, what we begin to see. And when people begin to see those things in their neighborhood and working together, as you said, with that grassroots effort, it begins to make you feel better. When you finally get to a place where you can feel and see, things shifting and changing in a direction that you can feel proud of.
Absolutely. And as you have talked about in previous conversations that we've had, it's important that we also incorporate other programs that we have in this initiative, particularly those that address home ownership, because we know that when you have home ownership, it brings a certain amount of stability to a neighborhood. There are vacant properties in most of these areas. So in addition to our TURN program, we want to incorporate our other programs that can complement TURN that will also be of some benefit in that overall transformation of the area. It's important that we get residents to be a part of that process because they will be the ones that address the sustainability of whatever this effort is. So we believe that the success, in part, will be driven by the community itself, and we're very encouraged and look forward to working with the neighborhoods on these programs.
I think you said something that was very important, that was sustainability. Because it's one thing to go into a neighborhood, a community, it doesn't matter if you're working on housing or you're working on commercial and economic development in a particular area, but if you go into that neighborhood and you do things that are not necessarily sustainable, you can throw as much money at it as you want to, but if you have not created an environment and an atmosphere where those improvements can be maintained or even move beyond what has been invested in those areas, you really hadn't made that difference. And I think sustainability is very important as we look at this program and we look at other things that we continue to do. How, when we make these investments, how does these things continue to be sustained moving forward for the long term and that duration? I know we had some community meetings and that took place when the process of this was working out and moving on. What was the reception that you all heard in those community meetings?
Actually, we received very good feedback and reception. Actually, some of the comments and things that we received from those meetings, we were able to incorporate into those initial draft guidelines and make some changes. So we're excited about the reception that we're receiving. I'd just like to add, when you talk about sustainability, another component of this program is we're going to require a mandatory attendance to our homeowner maintenance class. It is currently a class that we now have, and it is where we share with homeowners and renters the good things and the bad things about owning a home. So, changing your filters, the maintenance that goes along with it. So that's part of the sustainability as well, because everyone, if you're not used to living in a home, you may not know all the aspects that it takes to be a homeowner. So we're excited about that as well.
And I think I've felt and I've seen this excitement within our communities. I know I've been very much a proponent of the TURN program and of all of our housing programs in particular, because I think when we look at our neighborhoods and community, that housing and affordable housing is a very important process of individuals' lives. That when you look at communities and neighborhoods, it doesn't matter what part of town you live on, doesn't matter what section of the community you live on. I think everybody deserves the right, if you're living in a property and home, to feel safe and comfortable and live in a quality of a home as anybody else. It doesn't mean that you have to live in a mansion, but it does mean that whatever your mansion is to you, that it is a quality piece of property in a neighborhood that you can be proud of. And I think this program will help to continue to make sure that our neighborhoods and communities are bar none compared to any in other cities. And so I'm grateful for you all as staff, for the work that you all do consistently each and every day in this program that I believe is going to have tremendous impact. Are there any other things you'd like to share with the community about the program?
I would like to say thank you to City Council. We have a tremendous task of trying to provide products and tools to help improve our communities throughout the city. And without having an elected body that's willing to make the commitment of funds to do what we do, a lot of progress could not be made. So on behalf of the department, I would like to say thank you to you and the mayor and city council for supporting us in our efforts to help our citizens with these types of initiatives.
Thank you. Ms. Johnson?
Thank you. We're just glad to be here, and we're excited about getting the word out for TURN, and so stay tuned for more information.
All right, I'm excited. I'm ready to look at these neighborhoods and see the before and afters, and I think some others are very excited as well. So again, thank you.
Thank you.
We'd like to thank Mr. Richie Brooks and Ms. Sharon Johnson for being here today. If you would like to see this program in its entirety, you can view it on the city's YouTube channel. Thank you for watching.